Hi all, the topic we are going to see today is solar retinopathy. It is also known as photoretinitis or eclipse retinopathy. It refers to the retinal injury that is induced by direct or indirect sun viewing. It is associated with religious sun gazing, sunbathing, telescope solar viewing, solar eclipse view observing, and sun watching in psychiatric disorders. Coming to the pathogenesis. Pathogenesis involves photochemical effect that is produced by the UV and visible blue light, ultraviolet light, thermal effects or the long visible wavelength and IR rays from the sun are absorbed by pigment epithelium. So the severity of the lesion varies with the degree of this pigmentation, the amount of duration of exposure and the climatic conditions during exposure. Coming to the clinical features, there are some symptoms. There is persistence of the negative after image of the sun, progressing later into positive scotoma, which means the absence of central vision, which happens with even macular hole, and metamorphosia, which means distortion of vision. So there is a negative after image of the sun, which may later progress to scotoma and metamorphosia under the symptoms. Then there is decreased vision between 6/12 to 6/60, which develops within 1 to 4 hours, and it improves within 6 months to a range of 6/6 to 6/12 itself. Coming to the signs, initially the fundus may appear normal. Shortly after exposure, there occurs a small yellow spot with grey margin noted in the foveal and parafoveal regions. Small yellow spot with grey margin is noted in the foveal and parafoveal regions. Later, the lesion consists of a central burnt out hole in pigment epithelium surrounded by aggregation of molten pigment. So shortly after exposure, you will observe a yellow spot with grey margin in the foveal and parafoveal regions. Later, it will appear as central burnt out hole, already burnt out hole in the pigment epithelium surrounded by aggregation of molten pigment itself. Ophthalmoscopically, this appears as a kidney bean or kidney shaped pigmented spot. In worse cases, it may develop into a macular hole may appear. These are the signs. And treatment, no effective treatment is found for this solar retinopathy or photoretinitis. So we lay emphasis on prevention. Eclipse viewing should be discouraged unless we should not view the solar eclipse unless we have proper use of protective eyewear filters. Unless we are using the eyewear filters which can absorb the UV and infrared rays. Thank you.